And now to discuss the government's visit to Hammanskraal, including the state president, Cyril Ramaphosa, we are now joined by Tshwane MMC for Human Settlements, Ofentse Madzebatela, and he joins us via our Zoom link. Ofentse, thank you so much for joining us here on the late edition. I'm sure you've listened to that package which was prepared by my colleague, President, saying that it's all spheres of government which has failed the people of Hammanskraal. Do you agree with that sentiment?
Good evening, Bali, and to the viewers. I agree fully with the President that indeed this has been a failure for all spheres of government. As you would know, even in the President's speech, he has alluded to the fact that the alarm system on this issue started way back in 2004. So you can imagine as far back as 2004, government after government has been warned that this could become an issue, and here we are today.
And now that, it seems as if government is on board, be it provincial or national, and everybody seems to want a solution and solve the issue here of Hammanskraal. Are you satisfied with what took place today in terms of what government plans to do to finally get clean, drinkable water for the people of Hammanskraal?
Look, I would be satisfied if the solution was immediate. Because as you would know, water is life and it's a human basic right. But unfortunately, we find ourselves where we have to have a short-term, a medium-term, as well as a long-term plan. So for me, the best would have been that we can find an immediate solution, but unfortunately, it is not to be. But having said that, the intervention that are being put in place will be of assistance and will really help us in ensuring that we deal with this crisis of the water crisis in Hammanskraal.
And you are saying that, if it were up to you, this solution, or, it could be fixed as soon as yesterday already. How long, with these interventions now being made, how long can, the people of Hammanskraal wait until they actually get, clean, drinkable water because of these interventions we are now seeing?
Look, like I said, Mbali, there are three solutions. There's an immediate solution, and there's a medium-term solution, and there's a long-term solution. So the immediate solution would be the provision of water tankers by the city to the affected area of Hammanskraal and the surrounding areas. So we will be providing water from water tankers, and this water that the water tankers will be providing to the people of Hammanskraal will be coming from the hydrants that are supplied water by Magalies Water, as well as Rand Water. So they will be drawing from the hydrants of these two entities, Magalies as well as Rand Water. That will be the water tankers. And in the meantime, as they will be the provision of water tankers, the medium-term solution will be the Magalies plant that the President has spoken about. There is a short-term solution that will be giving water to that area. So we are told that by the technician that this new plant would be finished within the next 6 months. And then while that is happening, phase one of Rooiwal will be completed, which, as you would know, that it ended at 68% with the previous contractor who was terminated due to poor performance. And as you would know, that there is disciplinary hearings that are taking place from the city side to deal with the awarding of that contract and around the issues around that contract. Then the long-term solution would then be phase 2 and phase 3, which today we got good news from the technicians from both the city as well as the Department of Water and Sanitation nationally, is that phase 2 and 3 can be done parallelly. So we won't have phase 3 anymore, we'll just have phase 2. So once phase 1 is done, then we go into phase 2. So all these phases have now been compressed with a time frame of completion of 3 years from now. Because you would appreciate that in order for us to finally solve the issue of Hammanskraal is that we need to deal with the pollutants that are coming from Rooiwal, that are polluting the Apis River, that is feeding the water treatment plant in Temba. So we need to fix that so that we can have a long-term solution around the Hammanskraal situation.
And of course, Ofentse, you're telling us about, this will take at least 3 years to fix the problems of the people of Hammanskraal, specifically looking at Rooiwal. When it comes to, the efforts of the city to contain the spread of cholera, we continue to see an increase in the deaths of those with the cholera outbreak. Have you been able to sort of contain the spread of the cholera outbreak in Tshwane? And what are you doing to ensure that we don't continue to see more people get infected?
Mbali, we continue to do the following. We have ramped up the number of water tankers that we are providing in the area, so that people can have access to clean water, because it's important that we keep the good hygiene practices that the Department of Health have shared with the public. And also, what is far more important is that once people start having symptoms of cholera, that is your diarrhea, your vomiting, people must subject themselves or present themselves to the relevant healthcare facilities, so that these issues can be dealt with. Because the more you wait, then you risk issues of organ failures, kidney failures, dehydration, and hence that leads to death. But if people can subject themselves or present themselves earlier, and they can be treated from this. But also practicing good hygiene, washing your hands once after using the toilet, and also before you handle food, that would help a lot.
And Ofentse, probably if maybe you can just give us a bit of an insight in terms of how far is the investigation to actually find the source of the cholera outbreak. Is it quite clear, where the source is? I understand that a lot of focus is being put on the Rooiwal water treatment plant, but do we know as yet where this stems from?
Yeah, look, maybe the issue of Rooiwal, the attention to be at Rooiwal is because of the polluting of the water that is going to Hammanskraal. But I can assure the public that based on our technicians, that the water treatment plant in Temba that is providing water in that area is regularly tested for the bacteria causing disease causing bacteria, and we have continued to pass the test around it. The only problem is our physical attributes of the water. That is, you would find other elements such as your ammonia, and so those do not pass the test. Hence, we have always said that do not drink that water, but you can use it for other domestic activities such as cleaning but not for cooking and consumption. So far, we have done numerous tests as the city. We have done numerous tests as the Department of Health within the city, provincially and nationally. We are coming out with negative results as where the source is. But we have now roped in other entities such as your CSIR, the National Institute of Communicable Diseases as well. They have come on board to continue to help us with the testing until we find the source of this. We will not rest in Bali. But we are also encouraging people to practice good hygiene.
All right, then. Thank you very much, Ofentse. Of course, that is Ofentse Madzebatela there, the MMC for Human Settlements in the city of Tshwane, giving us an update when it comes to the issues of the cholera outbreak and the visit by the president and the provincial government to the Hammanskraal area.